Good evening. Today we are going to do pathology MCQ challenge. Pathology is a fantastic subject. It has a coverage of 25 questions in the NEET PG exam. And some questions with the knowledge of pathology you can well answer. Many questions of medicine and a few questions of pediatrics also. So please master this subject so that you score well in the NEET PG exam and get your dream rank and a dream PG seat. So let's begin with Michaelis Cudman body are seen in A. Xanthogranulomatous pyelonephritis, B. Malakoplakia, C. Nail patella syndrome, and D. None. So what do you think is the correct answer here? Now, what happens in malakoplakia? This malakoplakia is a variant of cystitis. It is related to chronic bacterial infection, mostly by Escherichia coli or occasionally by Proteus species. This malakoplakia is characterized by unusually appearing macrophage and giant phagocytes. It points to defect in phagocytic or degradative function of macrophage. It is a peculiar pattern of vesical inflammatory reaction characterized by microscopically soft, yellow, slightly raised mucosal plaque 3 to 4 centimeter in diameter. Histologically, it is characterized by infiltration with large, foamy macrophage with occasional multinucleate giant cell and interspersed lymphocytes. The macrophages have an abundant granular cytoplasm and the granularity is PAS positive. In addition to these histological changes, malakoplakia is also characterized by Michaelis-Guttman body. These Michaelis-Guttman bodies are laminated mineralized concretions resulting from deposition of calcium in enlarged lysosomes. They are typically present both within the macrophage and between the cells. They demonstrate positive results using PAS stain and are diastase resistance. They stain with COSA stain for calcium and PUL stain for Prussian blue. So the correct answer here is malakoplakia. DIC. Well, this question is quite commonly asked. This topic is very important. Disseminated intravascular coagulation is seen in A. Acute promyelocytic leukemia, B. Acute myelomonocytic leukemia, C. CMC, and D. Autoimmune hemolytic anemia. Well, disseminated intravascular coagulation is associated with acute promyelocytic leukemia, AML-M3. The leukemic cells of these types of anemia are hypergranular. Granules of these leukemic cells, that is promyelocytes, contain thromboplastin-like material resulting in widespread disseminated intravascular coagulation. Majority of M3 cases demonstrate a reciprocal translocation involving chromosome 15 and 17, T15, 17. So the correct answer here is acute promyelocytic leukemia. Liquefactive necrosis. When this word comes, the organ which comes into your mind is brain. The options given are A, heart, B, brain, C, lungs, D, spleen. So the correct answer here is B, brain. Please click the link in the description box to join the 2-day NEET PG Ultimate Breakthrough Blueprint event. It will be very beneficial for you and it will help you jumpstart your preparation, and also it will help you a lot in moving forward in your preparation pathway. It will help you revise the things. So those people, the first 10 students who click the link in the description box will get this NEET PG masterclass absolutely free, and it will be highly beneficial for you. It is a live masterclass. Now let's move. Flare in triple neck response is mediated by A. Axon reflex, B. Arteriolar dilatation, C. Histamine release, D. Local hormone. It is axon reflex. So the correct answer here is A. Axon reflex. Cystic medial necrosis is seen in A. Marfan syndrome, B. Friedreich's ataxia pattern. C. Down syndrome. D. Kawasaki disease. Cystic medial necrosis is a disorder of large arteries characterized by an accumulation of basophilic ground system substance in the media with cyst-like lesion. It is known to occur in certain connective tissue disease such as Marfan syndrome, Ehlers-Danlos syndrome, annuloaortic ectasia, which usually result from degenerative changes in the aortic wall. The relationship between cystic medial necrosis and congenital heart defects, as well as other disorders, have been evidenced. The mechanisms are still controversial, even though many molecular studies have been conducted. It is characterized by elastic tissue fragmentation and separation of elastic and fibrovascular units. Cause of constrictive pericarditis are A. TB, B. SLE, C. Brucellosis, D. A and B. It is both A and B, so correct answer here is D. Now, what are the causes of constrictive pericarditis? Causes of constrictive pericarditis are tuberculosis, most common cause, pericardial malignancy, especially breast, lung, etc. Post-viral pericarditis, especially hemorrhagic pericarditis. Drugs can also cause this. The drugs causing the constrictive pericarditis are hydralazine, procainamide, minoxidil, and phenytoin. Bacterial pericarditis can occur, trauma post-cardiac surgery, hemopericardium can occur, fungal pericarditis, that is histoplasmosis, can occur. Connective tissue disorders, SLE, RA, sarcoidosis can also cause constrictive pericarditis. In cell death, myelin figures are derived from A. Nucleus, B. Cell membrane, C. Cytoplasm, D. Mitochondria. The myelin figures are cytoplasmic bodies composed of concentric whorls of membranes derived from damaged cell membrane. Myelin figures appear during reversible cell injury, but they are more pronounced in irreversible injury. Enzyme that protects the brain from free radical injury is A. Myeloperoxidase, B. Superoxide dismutase, C. MAO, and D. Hydroxylase. It is correct answer is superoxide dismutase. Antioxidant mechanism. Cells have multiple mechanisms to remove free radicals and thereby minimizing injury. Several non-enzymatic and enzymatic systems contribute to inactivation of free radical reaction. Non-enzymatic system antioxidants, vitamin E, vitamin A, vitamin C, glutathione, and cysteine block the initiation of free radical formation and inactivate the free radicals. Tissue proteins, that is transferrin, ferritin, lactoferrin, and ceruloplasmin, iron and copper, can catalyze the formation of free radicals. So the correct answer here is superoxide dismutase. Fat necrosis is common in A. Omentum, B. Breast, C. Retroperitoneal fat, D. All of them. There are two types of fat necrosis. Enzymatic fat necrosis is due to action of lipase on the adipose tissue. It occurs most frequently in acute pancreatitis due to leakage of lipase. Depending on the severity of acute pancreatitis, fat necrosis may occur in adipose tissue contiguous to pancreas, that is retroperitoneal fat, adipose tissue in anterior mediastinum, bone marrow, omental and abdominal fat. Non-enzymatic or traumatic fat necrosis occur due to trauma is seen in subcutaneous tissue of breast, thigh, and abdomen. In apoptosis, cytochrome C acts through A. APF1, B. BCL2, C. FADD, FAT, D. TNF. Cytochrome C, well known for its role in mitochondrial respiration. Cytochrome C binds to a protein called APF1, that is apoptosis activating factor 1, and the complex activates caspase 9. BCL1, 2, and BCLX may also directly inhibit APF1 activation, and their loss from cell may permit activation of APF1. So the correct answer is APF, which is activated for nuclear fragmentation in apoptosis. A. Caspases, B. APF1, C. Oxygen free radicals, D. It is caspases. Caspases and endonuclease cause chromatin fragmentation in apoptosis. They are inactive, so first they should be activated. Cytochrome C binds with APF1 and this complex activates caspases. Annexin V is a marker of A. Apoptosis, B. Necrosis, C. Atherosclerosis, D. Inflammation. It is apoptosis. Which of the following marker is specific for gastrointestinal stromal tumor? CD117, CD34, CD23, S100. The following markers are present in GIS, that is gastrointestinal stromal tumor. They are CD117, that is c-KIT, 95%, C34, 70%, smooth muscle actin, 5%. CD117 immunoreactor, it is best defining feature for the GIST, distinguishing them from two smooth muscle tumors. Although CD117 is considered The most specific marker for GIST, it is not pathognomic of GIST as other tumors may also express CD117. These tumors include cell tumor, germ cell tumor, etc. So the correct answer here is A, CD117. Multiple epidermoid cysts are seen in A. Turkar syndrome, B. Gardner syndrome, C. Petersburg syndrome, D. Familial polyposis coli. Gardner syndrome includes adenomatous polyps of gastrointestinal tract, desmoid tumor, osteoids, epidermoid cyst, dental abnormalities, and periapillary carcinoma. So the correct answer here is B. Gardner syndrome. The features of Crohn's disease are all: A. Lymphoid hyperplasia, B. Skin lesion, C. Transmural involvement, D. cryptopsis. Now, lymphoid hyperplasia, intermittent mild diarrhea, fever, abdominal pain, right lower quadrant mass, weight loss, sometimes mimic or ball, anal complaints. So, the correct answer here is A. Lymphoid hyperplasia. Female is affected and male is not affected. Disease is autosomal dominant. What is the chance in children? A 50%, B 25% affected, C 75% affected, D all. If one of the parent, that is either mother or father, is affected in autosomal dominant disorder, every child has 50% chance of having the disease and 50% chance of not having disease. So it is 50% affected. The inheritance pattern of familial retinoblastoma is A autosomal recessive, B autosomal dominant, C X-linked dominant, D X-linked recessive. It is autosomal dominant. Male to male transmission is seen in A. Autosomal dominant disease, B. Autosomal recessive, C. X-linked dominant, D. Mitochondrial disease. It is autosomal dominant, which is not a feature of Down syndrome. A. Clinodectally, B. Pigmented birthmark, C. Hypotonia, D. Respiratory tract infection. It is pigmented birthmark is not a feature of Down syndrome. The general features of Down syndrome are mental retardation, short stature, craniofacial brachycephaly, epicanthic fold, protruding tongue, small ears, upward sloping palpebral fissures. Strabismus, nystagmus, brushbill spots, fifth finger, clinodactyly, single palmar crease, wide gap between first and second. It is pigmented birthmark. Lines of Jahn are seen occur in A. Postmortem collot, B. Infarct, C. Embolus, D. Correlline thrombus. It is Correlline thrombus. Anemia with reticulocytosis seen in A. Hemolysis, B. Iron deficiency anemia, C. Vitamin B12 deficiency, D. Aplastic anemia. Correct answer here is A. Hemolysis. Acute blood loss or hemorrhage. Hemolysis. Maximum spirochetes are seen in A. Autoimmune hemolytic anemia, B. Vitamin B12 deficiency, C. Aplastic anemia, D. None. It is autoimmune hemolytic anemia. The anemia associated with leukemia is A. Iron deficiency, B. Megaloblastic anemia, C. Myelocystics, D. All of them. It is myelocystic. Chemotaxis is mediated by A. Histamine, B. Leukotriene, B4, CA5, CS, leukotriene C4, and C3. It is B. Hyperimmune IgE syndrome is also called as Job syndrome. So the correct answer here is Job syndrome. Job syndrome is also called hyper IgE syndrome or hyperimmunoglobulin E syndrome. Is an autosomal dominant disorder due to mutation in signal transducer and activator of transcription 3. That is STAT3. There is a defect in phagocytosis. IgE levels are elevated. Other immunoglobulins are low.